live? Okay, I'm looking for people to trickle in here. I don't see there's any viewers yet. Oh, okay, there we go. Hello, everybody. My name is Josh Music. This is my dad, Marvin Music. We are going to be talking about Medicare tonight, specifically the consequences of filing for Medicare and I guess Social Security too early. So what happens if you file too early? And that could be, just in your enrollment deadlines and all that sort of stuff, but also what happens if you do it really before the best time is for you. So we're going to talk about the consequences of filing for Medicare and Social Security too early. After that's done, we're going to go into a question and answer, and I know this is a big reason why a lot of you are here. Usually we go for 60 to 90 minutes, and we just answer all of your questions. So I invite you now, if you want to go ahead, you can start typing some of those questions that you may have into the chat. We will address them sequentially. So as you put them in, we will go through them. And again, it usually takes 60 or 90 minutes to go through it. My name is Marvin Music. This is my dad. Pardon, my name is Josh. This is Marvin Music. My dad and I started this company, MedicareSchool.com, and our goal is really twofold. The first thing we want to do is we want to educate you everything you need to know about Medicare so that you can get great coverage. Okay, so you can be confident that what you're getting is right. And the second thing is we have a team of people that come to work every single day. And they come to work so that they can help you enroll in the coverage that makes most sense for you. So we're independent insurance brokers. We are a completely free service to you. So we long to educate you, and this is what part of this is tonight, and then we'll help you one-on-one with enrollment assistance virtually over the phone doing Google Meets or a Zoom call so that you can get the insurance that's truly best for you. So we're going to kick it off soon. If you would, hop into the chat and tell me where you're tuning in from. We are in Overland Park, Kansas, but one of the things that I like to do is always ask everyone where they're coming from. You come from California, Tennessee, wherever. Looks like Donald J. Says he's from Maine here, and then I'm also seeing something about the sound is wonky, it's echoing. So maybe check. Okay, it sounds good. Michael Weir says he's not getting anything yet either. Virginia Beach, Virginia. Hello, Virginia. Knoxville, Tennessee. Indiana, Kentucky, Oregon, Indiana, Vancouver, Washington, Marco Island, Florida, beautiful, Temecula, great wine country, San Bruno, Vegas, New Jersey, Oregon, Rhode Island, Iowa, Cave Creek, Cincinnati, Ohio, a lot of people from Oregon tonight, okay. Dallas, Texas, Louisiana, North Carolina, Alabama, Phoenix, Arizona, welcome, California near Yosemite. The only time I've been to Yosemite is just flying over. And everyone, they're playing, they're always like, look out the right side of the plane, and you can see Yosemite, but sometime I need to get there. Okay, so without further ado, we've got a lot of people on here. We're going to go through the consequences of filing for Medicare and Social Security too early.
All right, well, let's start with Medicare first. And I think the best way to remind everyone is that there's really, everyone's in one of two groups. There are some of you that have to go on Medicare at 65. In other words, you need to go on during your 65th birth month and no later, otherwise you're going to have complications. So let's talk about that group first. Who has to go on Medicare at 65? You have no options. It's real simple. 5 categories. Number 1, anyone that is no longer working or their spouse is no longer working, or you have no insurance, but you have no employer plan that's available. You have to go on Medicare at 65, and you should. The month that you turn 65, that should be your beginning month. Anyone that is covered by COBRA insurance, and this is very important because a lot of people mess this up. COBRA insurance, what happens if you don't go on at 65 and you're covered by COBRA at 65, the COBRA insurance company becomes the second payer. Their first payer up to 65, but once you're 65, Medicare has to pay first. So if someone doesn't enroll in Medicare at 65, then the COBRA is still only going to pay second, and then you would have to pay first. So again, if you have COBRA and you keep it, I wouldn't keep it very long, no more than 6 months for sure once you're Medicare eligible, but just know that COBRA pays second. So again, you have to go on Medicare at 65. Third, anyone that's retired from the military, you served in the service, Marine or Army, Navy, Coast Guard, whatever you did, you have to go on Medicare at 65 because what you have through the military is insurance called TRICARE. And TRICARE is great insurance. It pays first, but once you're on your Medicare eligible, TRICARE will only pay second. And so again, if you don't enroll, you become the first payer. And then next group, anyone that's on an Affordable Care Act plan, you have to go on Medicare at 65, because if you were to stay on your ACA plan at 65 or beyond, all the benefits of that plan go away. No longer are you going to receive a tax subsidy. There's no more cost sharing. You would pay the full premium, you pay the full deductible, and there's no reason to have an ACA plan once you're Medicare eligible. Technically, you could keep it, but there's no reason to, because again, all those incentives are gone. And so you're going on Medicare at 65. Then lastly, anyone that's covered by an employer-provided plan that is considered to be small group by Medicare, and that is 19 employees at the company, meaning 19 employees on the payroll or less. You're considered to be a small group, and once you turn 65, the group plan now only has to pay second. Medicare pays first, and again, if you don't enroll in Medicare, now you're the first payer. So that's the 5 groups of people. No one that's, if you're not working, you're covered by some kind of retirement plan, ACA plan, TRICARE, small group 19 or less, or COBRA, you have to go on Medicare at 65. Now, anyone beyond that is just one group of people, and that's those people that are still working or their spouse is still working, and the employee account at the company is 20 or more. You don't have to do anything with Medicare. And so when we talk about consequences of going on Medicare early, that would be you. You don't have to do anything at all with Medicare if you're in a large group plan. And so the consequences of going on early would be this. If you did enroll, let's say in A and B, the A has no premium, but the B has a premium. So the consequence is you're paying now for Part B, and Part B is going to be in the second payer position. Your group plan, because there's 20 or more, is going to pay first, and Medicare pays second. So my opinion, if you have a good group plan, I would not enroll in B. You're wasting your money. So again, group plan, you don't have to do anything with A or B. So that's the consequence, waste of money. Plus they're the secondary payer, Medicare would be. Now, some of you, the consequence of enrolling early, if you just did A only, because some people will hear, you're turning 65, you can stay on your group plan, but you still have to enroll in A only, and if you don't enroll in A, you'll be penalized. And that's absolutely not true. As long as A has a 0 premium for you, which means you've paid into the tax system for 40 quarters, 10 years worth of work, there will never be a penalty for you. I don't care if you take Medicare A at 65, 75, 105. There's never a penalty for A as long as it's 0 premium. And again, that's 99% of the population. So the consequence of you that are in large group, 20 or more, if you take A only, you can no longer put any money into an HSA, health savings account. Because Medicare says you have any form of Medicare, A or B, no new money goes into the HSA. So the consequence is, in my opinion, you just shot yourself in the foot, because HSAs are wonderful. The money goes in tax deductible. If it's a growth account, it grows tax deferred. If you use it for medical expenses, it's tax exempt. So it's like a healthcare IRA. So that's a consequence. You can no longer put new money into it. Now, if you decide to enroll in A only, it's fine, just no new money in the HSA. But here's my point. I would rather contribute to an HSA than enroll in A only, because in A only in a large group, it's only going to pay second to your group plan. It will not pay co-pays. It will not pay any deductibles. It only pays co-insurance. So I see the benefit greater of having that HSA than having Medicare A only in the second position. Now, those of you that don't have an HSA possibility, I would enroll into Medicare A only. Because why? They may pay a claim. You don't know. So it's all right to do that. You can have a flexible spending account and have A only. You can have a health reimbursement arrangement and have A only, just not an HSA. All right, enough of that. Let's go on. Let's talk about Social Security. What are the consequences of taking Social Security early? Now, as I talk about this, I think it'd be best really to give an example, because there's really 2 consequences. Number one, and you probably know this, but you're going to take a reduced benefit. And so for every year we take early before we hit our full retirement age, we're going to lose 6%. Now, if it's 6 months, it would only be 3%. So it's 0.5% a month. Now, my birthday is in January 1961. I just turned 63. My full retirement age is 67. So if I took it 62 and I didn't, that means 5 years early, I would have lost a full 30%, and that reduction is permanent. Okay, so that's the issue with taking early. You're going to take less. And so the first thing everyone has to do is you have to know your full retirement age. So let's just do a quick review on that. Anyone born between 1943 and 1954, 43 to 54, full retirement age, and even 66. No months, just 66. But after 1943, beginning of 1955, they started adding 2 months to your full retirement age. So if you're born in 55, it's 66 and 2 months. 1956, 66 and 4 months. 1957, we had 6 months. 1958, we had 8 months. 1959, we had 10 months. And then 1960 on, as I am, you have full retirement age of 67. So you have to determine that first. And I'm going to tell you why here in just a second. Because if we take early, not only are we going to take less, again, 0.5% a month, but if you continue to work and take Social Security, now you're going to be limited as to how much money you can make without it having some type of a penalty or a bearing on your Social Security check. All right, so that's the consequence. And that consequence is referred to as an earnings test. In other words, if you make above this certain limit, I'll give those to you, then you're basically going to be penalized. Your Social Security check is going to be reduced. And so that earnings test. Now, one thing to clarify on the earnings test, it only applies to working wages. It doesn't apply to investment income, rental income, pensions, annuities. None of that counts. Only working wages. That's the earnings test. Okay, so let me make this simple. Let's just use the example. Let's say somebody had a birthday today, Josh, and they're turning 65 today. That means they were born January 18th, 1959. January 18th, 1959. They turn 65 today. They have a full retirement age of 66 and 10 months. And so that's going to put them at a full retirement age and month and year of November of 2025. November 2025. So if we get to November 2025, we will not have to be worried about the earnings test, because once I reach my full retirement age, the earnings test goes away. Once I hit full retirement age, I can make as much money as I want. Doesn't matter the source, wages, whatever. But prior to this example of mine, 11/1/2025, what's going to happen is we have two earnings test numbers. I always refer to it as a low number and a high number. So we're always subject to the low number when we can first start taking at 62 up until the December before we hit our full retirement age year. So in my example, it'd be from 62. In this example, it would be through December of 2024, this year. And the most a person can make during that whole period of time is this year, it would be $22,320. $22,320. For every $2 I make above that, they take $1 out of my Social Security benefit. So let's say I'm above $4,000, they're going to withhold $2,000. That means they'll withhold $2,000 in Social Security checks before I can start receiving any money. It's front loaded. All right, now, then that low number is all the way up until December before the year I turn. But then they raise the number drastically the year I turn. So in my example, from January all the way to October, because remember, we said our full retirement age is in November. So we have this 10 months where we can make more money. And that number this year is $59,520 for the whole year. However many months are left in that year, in my example, again, 10 months. So we have $59,520. For every $3 above that I make, they take $1 out of my Social Security check. So I can make substantially more money and the penalty is less. But once I hit my full retirement age month and year, now earnings test is eliminated. All right, so that's the consequences of filing for Social Security early. You're going to take less, and you're going to be subject to the earnings test. I guess the third consequence would be by taking early. If you'd like to have more money, then you can wait beyond your full retirement age, and you can actually grow that account at 8% a year. Now, again, my full retirement age is 67. I couldn't grow mine 32%, but I could grow it 24%. Yeah. Because at age 70, you might as well take, because with the present rules, there's no growth beyond cost of living adjustments once we reach age 70. All right? All right, so I know that was a lot, but hopefully it's helpful. We are happy to take any specific questions around that, something else that you may be curious about. That's the consequences.
Okay.
Okay.
We are going to start back at the beginning of the questions. So Mark Dietz says, I missed the end of the year date to file. When can I file now?
At any time. As long as you are 62, you can file for Social
I think
Security.
he's talking about Medicare or Social Security.
Oh, I'm sorry.
Mark, why
let's
don't you
know.
clarify your question? What are you asking about? Give us a little more details, and we will get to it.
Sorry about that. I thought he was, yeah.
Okay, if you win the lottery, does that count toward the IRMA?
Yes,
Yeah,
it does.
absolutely.
It sure does. Yeah, all income is countable for the IRMA. IRMA is modified adjusted gross income, so lottery income would definitely count.
Okay, Gail Black, I referred a couple of people to you all this month, and they were really satisfied. Thank you for taking care of them. Thank you, Gail, for
Yeah.
passing our name along. We really appreciate that. Again, guys, we've got a team of people out here that are ready, willing, and able to help you walk through the Medicare process, get your plan set up, get enrolled for A and B, do all the paperwork, help you compare supplement plans, advantage plans, drug plans, all these different things to make sure you get the right coverage. And this service is free to you. We're paid by all the insurance companies we represent as independent brokers. Okay, Renee Adams says, if your income is very low, how do you apply and get help through Medicaid, or is there another source to help someone pay for their Medicare?
All right, very good. Renee, there's two ways you can apply for Medicaid. You can go through your state. We'll definitely have a Medicaid department, or you can actually apply for Medicaid when you apply for Social Security or for Medicare. The Social Security offices can also take care of that application.
Okay, if still working and have health benefits at age 65, is it advisable to enroll in Part A or wait to enroll in Part A and B once you stop working?
Okay, it's fine to take A, Mike, as long as you don't have an HSA. And I would frankly do so because there's no consequence to having A other than no new money goes into the HSA. So again, if you don't have it, HSA, enroll in A. I think that's very smart. If you have an HSA, I keep contributing that. This year, the limit is $4,150 for an individual account, doubled if it's a family account. And then after 55, you can put an extra $1,000 a year in. And so if you have an HSA, I'd be maxing that thing out if you can and do nothing with A or B. It's fine.
But you can wait to enroll in A and B when you stop working.
Exactly right. And by the way, in fact, I just did one right before I got in here, and that's called an SEP enrollment, special enrollment period. And all we have to do is we have to verify that you've had credible coverage at work, you or your spouse's work back to 65. This couple I just met with, they were 73 years old, both of them. He was the one that was working, covered by their plan, so we had to go back 8 years with an L564 form and prove that they were working and covered by the group plan. No, it's seamless. It's so simple to do. And by the way, if you do become our client, we're happy to guide you through that entire process.
I also put up on the bottom of the screen here, so you would enroll in A online if you didn't enroll in A and B at 65. So you would enroll in A online at socialsecurity.gov.
Yep.
There's a button that says apply for Medicare. You do that, and then you can use the CMS L564. Your employer fills that out. And then CMS 40B, you fill that out, and both of those documents together go into the Social Security office, and that is what will enroll you into Medicare Part A and B without any penalties, without any gaps of coverage, without anything at all.
Yeah, Josh, right. I just want to add one thing. So think about it. The L564 proves that you can come into Medicare with no penalties, no problems. The CMS 40B form is you choosing the date that you want to start. This couple I just met with, they want to start April 1. And so we put on the form, please begin my Medicare Part B 4/1/2024. And by the way, you'll never turn that paperwork in, folks, any sooner than 90 days of the effective date. All right, so if someone says it's going to be June, you're not ready to do that yet. You want to do it within 90 days. They won't process it in advance of that.
Okay, let's go. Bella, I have to sign up soon. My birthday is in June, but I'm confused by the alphabet of parts.
Right.
So all you need to do, go to MedicareSchool.com, and then there's a button that says Get the Workshop. I think it's about a 40-minute workshop. It's going to be a video that's going to walk you through Medicare from A to Z, right? It's going to talk about how to enroll, when to enroll. It's going to talk about parts A, B, C, and D. It's going to talk about supplement plans, the pros and cons, the advantage plans, pros and cons, how to get drug coverage, how to avoid penalties, how to avoid mistakes. All these different things are covered in this Medicare workshop. So you can go to MedicareSchool.com, click Get the Workshop, and you need to watch that. And then you will feel much less stressed, much less confused. You'll feel confident because you're going to know what you need to do. Right, and it's all free. Just have to give your email address, and then we email that workshop to you.
Yeah, can I just add a comment here, Josh, to Bella, really everyone. If you are already on Social Security, you will be automatically enrolled into Medicare A and B. So in that situation, there's really nothing you have to do. Now, Bella, if you are on Social Security, your Medicare card is going to show up between about the 15th and the 25th of February. Okay, so I just backed up the count a little bit, and if your birthday's in July, it's going to come in March. So it's always mailed to you about 100 days prior to your birth month. Now, the exception would be if you're born on the first day of any month, then you always start your coverage 1 month early. So just remember that. And I may also mention this about what our earlier topic. Listen, if you are on Social Security and you are covered by a good group plan of 20 or more, you're still going to be enrolled in a Medicare A and B, but you will have the option to delay taking your Part B. So again, if you have a group plan 20 or more, even though the Medicare card shows up, you can mail it back in, you got to sign on the back of it, and they will drop off the B, and again, you pick it up at a later date, they'll mail you a new card that'll say Medicare A only. And so I highly suggest it. That would be a mistake if you've got a good group plan to stay on B, because again, they're in the second payer position, and now you're paying $174.70 a month minimum for your Part B coverage.
Okay, the retired cop says, if my wife turns 66 on August 29th, when does the period start that she can make the higher amount of wages and not be penalized?
Okay, so she's what, August? So we're going to go 8/1, and she turned 66, so that means she was born in 58.
Yeah.
Okay, and I'll tell you, just you can keep on going. So, and so she's born in 58, so we know we have 66 and 8 months.
Okay.
So 8/1 of 2024, and we count the 8 months, September, October, November, December, January, February, March, April. So she'll hit April of 2025. Okay, here's the answer to your question. January, not this year, but January next year through March, January, February, and March, she'll be able to make $59,520.
Divided by?
No, they don't prorate.
Okay.
It's an annual amount. Yeah, you could do 2 months and you can make the same.
60 grand?
Yeah,
Wow.
they do not reduce it. It's an annual amount. And then in April 1, then from that on, she no longer has an earnings test. So she can make unlimited amounts of wages then. So those first 3 months, January, February, March, will be the months she'll be at the higher amount. Now again, next year it'll probably be a little higher, but if someone was doing that right now, it's $59,520.
Okay. Let's see. I have type 2 diabetes and a heart condition. What are the best plans for me, and what are the best drug plans for me? Okay.
Okay, let me tackle
It depends, right? So if you're just now beginning Medicare, we're probably going to recommend you get a supplemental plan, like a Plan G or a Plan N. To be able to speak to what the best drug plan is for you, you're going to have to call in. We're going to have to look up your medications, because there's 25 different drug plans. Usually in most markets, we just plug in, these are the medications, and it spits out and says this is the right plan for you. But we would probably recommend some sort of a supplemental plan if it fits your budget. If it doesn't fit your budget, we're going to go to the next best thing, and we're going to look at the Advantage plans. We're going to say, what is the best Advantage plan that covers your medications, that covers your doctors, to make sure the hospitals are a network that has a low maximum amount of pocket, that makes sure maybe it's a PPO plan, not an HMO plan. So we're going to look at all those things. The main point I'm trying to make is I can't answer this question, but if you call in, there's an 800 number scrolling along the bottom. Call in. We're open for another hour and a half here, I think. Schedule an appointment with one of our agents, and they'll be licensed, knowledgeable of the plans in your area, and they have the tools to be able to look and see what are the right plans that make sense for Bill.
Hey, it's good. I would want to add one thing too about this. The good news about your drug plan, and hey, I just wrote 2 of them, and they were 50 cents premium. That's probably not going to be a good plan for him with the heart meds, but regardless of what plan you go on, the most you'll spend in 2024 for out-of-pocket medications for you this year's $3,350. That Inflation Reduction Act put a cap for 2024 at $3,350. And next year it's going to be $2,000. And so again, Josh is right. Let's find the right plan. But again, at the end of the day, it's still not going to be any more than $3,350 out of your pocket. And with type 2, you're probably on Jardiance, you're probably on something else. That's pretty common when they have a heart condition as well as type 2. So those are expensive.
Cynthia Peterson says, hi, both myself and my husband have just signed up for Part A only, as we're both working still and he has the group coverage on us. So what do we do before he retires to get Part B and G?
Okay, very good. So what's going to happen, Cynthia, is, and the time frame, if it were me, I would do this about 90 days before you know he's going to lose his group plan. Again, I keep talking about this couple. They're going to lose their group plan 3/31, so they want to start their Medicare 4/1. And again, we just met with them, so perfect timing. So about 90 days prior to when that group plan is going to expire, what's going to happen is there's going to be one form called the L564 that's going to be necessary for both of you. The L564 will be given to the HR department, and your HR department, is going to verify that you all have been working, or he was, and covered by insurance. And we always got to go back all the way back to 65. And then the CMS 40B form, you would put on there, I want to start my Medicare Part B, 4/1, whatever year, or 7/1, whatever the date is. And then what will happen is that's going to take care of getting everything taken care of your Medicare. And then when it comes to your other insurance, then again, that 90-day window, we could look at supplemental plans, we could look at Advantage plans if you want to go that direction. So that 90-day window is perfect as to when to start setting this up. Number one, Medicare is not going to process any paperwork in advance of that anyways. So hopefully that helps you.
Also, would Part G cover hearing aids?
No, not yet. Not presently. I should say maybe never.
Yeah.
They've tried to get more dental coverage with original Medicare as well as hearing aids, and so far there's been nothing passed at all. So it'd be Advantage plans are going to offer those. But I would also tell you there's a lot of good over-the-counter hearing aids. You don't see prior to just a couple of years ago, you had to have a prescription for a hearing aid. And they eliminated that. So you can get decent, really good hearing aids over the counter now.
Okay, Michael Weary says, are the start dates based on your birth date?
They are. So if you're born on the second day of the month thereafter, it's always your birth month.
We're talking about Medicare.
That's
here.
right. That's
Yeah.
right. And really Social Security as well.
Yeah.
And then if you're born on the first day, they're going to move you to the previous month. So let's say somebody's birthday is February 1. They'll be eligible for Medicare at 65 in January. Okay, so they move it to the previous month. And Social Security, they use the same system.
Okay, Bill Clare says, I'm receiving Social Security. When will Social Security Administration send me verification that they have enrolled me in plans A and B? The answer to that is about 100 days before the first month you're eligible. So if you're born from the 2nd to the 31st, you're going to be eligible the first day of that month. If you're born on the 1st, you're going to be eligible the first day of the previous month. So it'd be 100 days before wherever you fall
They'll
in
mail
there.
you the card. Josh is right. I gave that example of this lady just a minute ago. Her birthday is in June, and she's going to get her card in February. So look at the month, back up 3, and then it's going to be about 2 weeks before that.
Okay, Dean C. says, is there any new issues for 2024 for taking Social Security early at 65 years old when starting Medicare? I have done a break-even analysis for my wife and understand all that. Any new developments with Social Security? Don't think so.
No. The only thing that changed with Social Security was the amount of income that's taxable. It moved to $168,600 this year. That was really the big change. Nothing else whatsoever. Of course, cost of living adjustment was 3.2, but
Okay, Scott says, can you use GoodRx instead of signing up on a drug plan?
no. Now you can use GoodRx, but never instead of signing up for a drug plan. GoodRx is wonderful. Hey, look, I looked at Kuban's group the other day. What is it? Cost plus
yeah.
drugs. But again, those are primarily good for generic medications. And so the reason GoodRx is not a substitute for a Part D plan, because if you go without a Part D plan and don't sign up, then once you're eligible for Medicare, they will start charging you penalties. And frankly, the penalties are not a whole lot, but the biggest issue is the risk involved. Hey, we have a lot of agents. One of our agents is one of my other sons. I have 3 sons, 4 daughters. One of my sons works here, and he was telling me, he looked up a medication yesterday. It was $16,000 a month. $16,000 a month. Listen, if you need that medication, GoodRx coupon's going to give you about $50 off on that thing. But you go on Medicare, that $16,000 a month medication is going to cost you $3,350 for the whole year. Yeah. So we don't get drug plans based upon the meds we're taking now. We get them just in case we had something that's going to be very serious. You want Medicare to cover that. GoodRx is not going to. And by the way, I love GoodRx. I tell people if they take a medication as needed, maybe a dermatology cream, maybe once a year, I think those are good things to do. But you want a drug plan. Hey, you can get some of them now 50 cents a month. Zero. We have a plan right now, 0 premium. So just get on a basic drug plan just in case. And then drug plans, the good news is, can be changed on an annual basis during the Medicare open enrollment season. So, no.
Okay. Jerry Buchanan, I'm seeing some ads about getting a $3,000 spending card that is apparently tied to starting Medicare with them. What is the $3,000 spending card about?
Okay, well, that $3,000 spending card for sure is for anyone that is going to qualify for Medicare and Medicaid. That's the only way that's going to work. Now there are some spending cards on people that don't have Medicaid, but that kind of dollar amount you'd have to, we call that a dual eligible. And Jerry, those plans are, we call them DSNPs. It's a special needs plan designed for a certain type of an enrollee, and that would be an enrollee who not only qualifies for Medicare, but also for Medicaid, meaning they have low income, low assets, low resources, and that's the one that would get that type of spending card that can be used for a variety of things. So I know some of the plans this year give you like a medical card where you can use, like $200 a month or something. But if you're talking about spending card for groceries or for rent and those kind of things, all the plans that I've seen thus far, those were Medicare, Medicaid eligibles.
Okay.
And that means you're on an Advantage plan,
Let's see. What else? Just going through a bunch here. Let's see. Your opinion on Advantage plans. I see they're rejecting so many claims that some hospitals and states are dropping them. What's the supplement?
Okay, good. Well, my opinion about Advantage plans is they are decent insurance. Okay, supplemental plans, I would call them, premium insurance, excellent insurance. And so supplemental plan, the person is asking this, what that means is that this is a person that stayed in original Medicare A and B, where Medicare is the first payer. Now, Medicare doesn't pay anything 100% other than preventive services. So when you get a Medicare service, non-preventive, there's always a balance of the bill. So that balance is your responsibility. So what a person can do, instead of having to be out of pocket for those balances, you can take the risk of that and transfer that risk to an insurance company, and they issued you a supplemental policy. They're filling in the financial gaps that Medicare did not cover. And again, you got to pay a premium for that. And so some people cannot afford a premium for that. The average right now for a G plan is about $125 a month. An N plan, maybe $100 a month. And some people just cannot afford that. And so that would be the person, in my opinion, that should get an Advantage plan. So if there's no extra money in the budget, you can't afford a supplemental plan, then let's find the very best Advantage plan that you can. Now, the reason that I'm not a real fan of Advantage plans, there's really a couple of them. Number one, you're always going to deal with networks, HMOs and PPOs, and that means you are going to have restrictions. If I have a supplemental plan, I can go to any doctor, any hospital that takes Medicare. So it's almost unlimited choices. Advantage has networks. Secondly, Advantage plans, 70 to 72% of the time, any service you're going to get recommended by the doctor has to be approved by the insurance company. So your doctor does not have the final say-so. That's why some hospitals and doctors drop those plans, because they don't like this pre-authorization process that's allowed with Advantage plans. Supplemental plans never have that. The supplemental company, the insurance company, cannot interfere, cannot delay, cannot deny coverage. If Medicare covers, supplemental plan has to cover. Point is, on supplemental plans, your doctor has the final say-so, not an insurance company. And that's what happens with Advantage plans. Okay? And that's the big issue. Plus, supplemental plans are for life. And I don't care where you are, you have that same coverage anywhere in America. Advantage plans didn't work that way. They're 1 year at a time, and again, networks. So you could have some issues.
Okay, I'm going to stop real quick. We love helping all of our clients, and I know there's probably several clients that are on here, so meaning you purchased insurance through one of our agents. If you would, drop in the name of the person that helped you. Justin, Josiah, Darren, Evan, I mean, there's a lot of them. Brandon, drop in the name of the person that helped you, just saying you're a client. We would love to see that so that we can show them tomorrow that they have some happy customers. Okay, drop in the name of the person on our team that helped you. We'd love to see that. Let's keep going. Carol Breck said, I signed up for Part A and B, but I have not used it yet. And I have insurance with my employer, and I am 65 in July 23. Applied at the end of July, got my cards, but didn't really want to get whatever part means.
She probably means Part B. Okay, so what I would, Carol...
She said she signed up for Part A and B.
I know,
okay.
I know, but she hadn't used it yet. But okay, here, Carol, if your employer has 20 people on the payroll or more, then what I would do, if you're not using the Medicare because you got a good group plan and you're going to keep working for a while, what I would do is I would go ahead and disenroll for Medicare Part B. You can do that very easily. You can go online and Google the form. It's called CMS 1763. 1763. And so this is for people that have to disenroll from Part B, and it's pretty self-explanatory, but I want to clarify something. when you're looking at that form, it's going to say supplemental insurance, and that's what they're calling Part B. Okay, it's either called medical or called supplemental. A is hospital, B is medical, but on that form it says supplemental. So I would fill that out now, and it'll ask you when you want to make that effective, and I would do it January 31st, 2024. And you're going to send that into your local office, or you can drop it off, but you can Google for your local Social Security office and send in the 1763 form and disenroll. Then you can pick up B at a later date. And then again, you can have no gaps in your employer coverage back to 65. So as long as we've had continuous employer coverage, you or your spouse is back to 65, then you'll qualify to pick up B at a later date. No penalties, no problems. I've talked a lot about that already. That's the L564 and the CMS 40B forms that you would use to come into B at a later date. Now, Carol, if you're going to retire, your husband going to retire, whoever is going to retire in the next couple of months, I wouldn't do that. But if you know you're going to keep working and stay on that group plan for 6 months or more, I would get out of the B. And you can come back in later, and I promise there's no penalty as long as we have continuous coverage.
Okay, Diane Preety says, I will be 65 in May. I've worked up to that point and will have made over the wage allowance of $23,320. How will this work? Will this affect me paying more taxes?
Okay, so here's the way this works. What I'm going to assume at this point in time is that you're going to stop working afterwards. So here's what happens. The year that you retire, they actually, we can look at one of two numbers, okay? And so because you're above the $23,320, and I'm going to say you're done working at that point in time, on the application they're going to ask you, now from the date you start taking moving forward, how much money are you going to make a month? So hey, can someone do 23,320 by 12?
Yep. 23,320 divided by 12 is 1943.33.
Okay, there you go. So what it's going to ask you is how many months now, that, since you're going to retire, have you been below this number Josh just said, the $1,900 number. So what they're doing is the year you retired, they give you the benefit of the doubt because they know a lot of people would have been above that number. They don't hold it against you, and then they will do it on a monthly basis. Now, when you get into next year, 2024, it's going to be the annual amount. But it's that first year, they look at total annual, or take it by the month. I'll ask you how many months were you below that. So it works. And it's on the application, and it's frankly pretty self-explanatory.
Okay, this is an interesting question. Can you have prescription through work and still be on traditional Medicare?
And yes, you can. It's as long as it's credible. So what happens is every year your insurance company is supposed to let you know if that drug plan at work is considered to be credible, which means it's equal to or better than original Medicare D plans. And if it is, then yes, you can. He does not have to have it. And then down the road, when you do pick up a D plan, you're going to have to justify that and prove that. So be sure to keep those credible coverage letters. But yes, you can.
Okay, is the company required to provide me evidence of creditable coverage each year, or only when I retire if I stay in their insurance? How do I know if the company's coverage is creditable?
Yeah, every year. Well, the company knows. The insurance company does. So yeah, they're supposed to send you that as once you hit Medicare age 65, you're supposed to get those every year from your employer.
Robert Cabral, if my spouse is still working and has insurance company more than 20, if I file for Medicare, can it be the second payer?
Okay, it will be.
Yeah,
it will. Yeah, you don't get to decide that. It will be the second payer. And really, Robert, when you think about it, if your spouse has a lousy plan, then I'd probably have A and B. But if your spouse has a good plan, I wouldn't take Medicare B. I would just take A only, because in that position, Medicare is going to pay second. And I just haven't seen Medicare be that great of a second payer. Now, if money's no object and you're all right paying the monthly premium, it's fine. But I would also tell you this. Unless you live in New York, Connecticut, Maine, or Massachusetts, the problem with you going ahead and having A and B and having the group plan as second is because now you're going to be on your 6 months of your B date. So you could have some issues picking up a supplemental plan in the future, meaning you may have to go through underwriting. So I'm not a real fan. If you have a group plan, I would just have A only. And if the group plan's bad, just get off of it. Your spouse is probably paying something for you anyways. Drop you off, and you take A and B and get a supplemental plan or Advantage plan.
Okay, if I go on an Advantage plan, then choose to go back to my current supplement, is it true that it requires underwriting even if it is open enrollment time?
Okay,
kinda
okay.
depends.
Well, here's the way it works. Let's just say, in this, Roxanne, let's say that you started with the supplemental plan and you're on one for a year or two or whatever, and you move to an Advantage plan. What you have is what's called a 12-month trial right in that example. You start with Sup, move to Advantage. But here's the issue with that 12-month trial right. If you want to get off, you must make the move back to that supplemental plan within 12 months, and you have to go back to that same company, unless they're out of business, and they're probably not. You have to go back to the identical company. So it's not like you can, pick another supplemental plan without any underwriting. Just that carrier has to take you back during that 12-month window. After that, would be required underwriting.
Yeah. Okay.
And folks, keep this in mind. Roxanne, I like what you said, even if it's open enrollment time. Listen, open enrollment that we talk about, the October 15th to December 7th, really has to do with Advantage plans and prescription drug plans. Supplemental plans can really be changed at any time. It's those two plans that are annual plans that really are subject to all the open enrollment rules.
Okay. I understand that if I sign up, that I can sign up for Medicare up to 2 months before I turn 65. Does that mean that I receive Medicare 2 months early, or is it the first day of the month of my 65th birthday? So you can actually apply up to 3 months in advance. And then it would begin, it's not going to begin early. It's going to begin on the first day of the month of your 65th birthday.
That's right. So you're not starting early. You can enroll early, but you can't start early.
Okay, Lola Lucky, you're asking, how do you know if you're in a supplement Medicare or Advantage Medicare? Pull out your card. If your card, so you're going to have a red, white, and blue card probably, and then you're probably going to have another card, and that other card should say something like Supplement Plan G or Supplement Plan F or Supplement Plan N. That's how you're going to know. If it says something like PPO H1604-something, that's probably an Advantage plan. Or if it says PPO plan, or if it says Advantage plan, that's how you're going to know.
And also, if you've been on a while and you have to pay co-pays, well, you're on an Advantage plan. Because supplemental plans really don't have copays. It could have some, but that's usually a pretty good distinction. Plus, if you're on a supplemental plan, you're paying a premium for that on a monthly basis. It's coming out of a bank account, or they're billing you quarterly, but you're paying for that. So you probably would know that for that reason as well.
Okay, I will be drawing on my ex-husband SSI. Can the amount grow if I wait to draw it, or is it a straight draw of 50% of his earnings only?
Okay, well, a couple things, Anna. Number one, your ex-husband, if you're going to draw on him, he has to be at least 62. You had to be married for at least 10 years or more and did not remarry prior to the age of 60. If you remarry prior to the age of 60, you can't draw on your ex-husband unless that second marriage ended in death or divorce. So that's a couple of real important rules. Now, if you have been divorced longer than 2 years, your ex-husband does not have to be taking his own Social Security. But if you've been divorced less than 2 years, then he has to be taking. Otherwise, you're not going to be able to take yet. Also, when you talk about the straight 50%, the way that works is that 50% amount is based upon his full retirement age amount, as long as you are not taking early. Because let's say he's eligible for $3,000 at his full retirement age, which means you'd be eligible for $1,500, but you take yours a year or two early. You're going to be penalized, and it's more than 0.5%. It's actually 25.36 or something. It's about 0.70% penalty per month if you take a spousal benefit early. Also, Anna, if you keep working, when you take before full retirement age, you're also, even with spousal, going to be subject to the earnings test. So there's a lot that goes along with that. So hopefully that's helpful.
Okay, Stephanie Bailey says, I don't have a question. Just want to let you know I referred someone to your company who was very confused. She walked away happy and got a great plan for her.
Good.
Thank you for what you do. Well, thank
That's
you
great.
for referring us. We really do appreciate it. Let's see. This is a good question. If you are enrolled in Medicare A and are still working, can you unenroll so you can go back to the HSA at work?
No. The only way that you can disenroll for Medicare A is if you pay a premium for it. And if you look on that form 1763, that's exactly what it says. How to disenroll from premium Part A and of course Medicare Part B, because you pay a premium.
So 99% of people don't pay a premium for
exactly
A,
right.
So
now let me share one thing about this. Here's what I do think, Josh. I think if someone has enrolled in A and they're still not effective, Like, let's say I enrolled in A for an effective date of 3/1 or 4/1, I think I can disenroll if it's not gone effective yet. So that's when you could probably undo that. But if the A effective date is in the past, I do not think you're going to be successful trying to disenroll. Now listen, you can try if you want. It would be that 1763 form, but I have not seen it go through that way. If it's free and it's already gone effective, can't. And that's a bummer. It is. But hopefully it hadn't gone effective, you can do it.
Yeah.
Pretty sure it's the way it works, as long as it's not gone effective yet.
Okay, what if my husband uses HSA? I'm on his insurance. If I apply for Part A, will he still be able to use HSA for both of us?
Yes, he can. He just can't contribute the family amount. He can only contribute on for his, that 4150 plus 1,000. But the money can still be used for yours as well, your expenses.
Okay, I just signed up for Part A in October, but I'm still working, which covers my insurance. I just heard you say that wasn't necessary. Can I revoke being signed up? Oh, well, we just kind of answered that. No.
Yeah, and you don't really need to. You don't need to. If you don't have if you don't have an HSA and you have Part A, it's fine. In fact, I think it's smart. Yeah, because they may pay something. If you had a claim, they're going to pay second, but they still may. So yeah, don't fret over that, please.
Okay, does working wages mean gross or net? If you are self-employed, would it be before or after write-offs?
Okay, yeah, self-employed would be net self-employment income.
Yeah.
But your W-2 is going to be gross, yeah.
Okay, Steve Cook from Facebook. Guys, if you're not in our Facebook group, I haven't mentioned this yet, you can go to, just Google actually, let's drop the link in the chat. You can join the MedicareSchool.com Facebook group. We've got 36,000 people, I think, in there. A lot of them are our clients. A lot of them aren't. And we've got a wonderful lady. Her name is Tara Yancic that manages that group. And she is in there all day long, 24 hours a day, it seems, answering questions about Medicare and helping you guys get the answers you need and then get you connected to people on our team if you need to enroll in coverage, if you need help. So we're going to go ahead. We just dropped, Daniel just dropped that link in the chat. So you can click on that real quick if you want. And join that group. There's a couple of questions you have to answer, and then you'll be in that group. You can ask questions and hear from people who are truly already on Medicare than some of the experts on our team. I want to caution you, if you're in that group and somebody sends you a direct message and they're like, hey, my name's so-and-so from Medicare School, don't believe them, okay? There's agents that lurk in that group and they try to find business, I guess, in that group. So just don't pay attention to that. If it's not myself, I will post in that group, or Tara Yancic, don't pay attention to anyone who sends you a direct message from that group saying they're with our company. We have a philosophy here at MedicareSchool.com, and that is you reach out to us. Okay, there's so many companies that exist out there today, and their primary way for getting clients is cold calling you, sending you direct messages, showing up your doorstep, all these things where they reach out to you and try to cold call you or pressure you into something. We have taken the exact opposite approach. Unless you reach out to us, we're not going to bother you. Okay?
That's right.
So go ahead, hop in that Facebook group, and I will end my rant. Okay. Is there an earnings test if you're receiving IRA distributions? No, it's earned wages.
Doesn't count. Doesn't count at all. It would affect your IRMAs, your modified adjusted gross, but it has nothing to do with earnings at all. Hey, someone had a question about that party. I thought it was interesting. Since you went to...
Well, he's way down the line.
Oh, I'm sorry.
We're
I'm
30
sorry.
minutes.
Okay.
We've got a lot of comments. So let's do
good.
this.
I'm sorry.
Lonnie Haas says, I understand you can use Form SSA 44 to appeal the IRMA to establish your Part B. You want to explain that?
Yeah, exactly right. So the way it works, if you're on Medicare, they establish your Part B premium based upon your modified adjusted gross income, line 11 on the tax return, line 11 plus line 2A, AGI plus tax-exempt interest. Those two numbers are what Medicare is going to look at to determine your Part B premium. So this year, they look back at 2022. So 2024, look at 2022, 2025, they're going to look at 2023, always 2 years back. So what happens if someone is going to start Medicare in 2024, they were working in 2022 and they had high income, but now they're going to retire or semi-retire, then you have the opportunity to appeal, which means you're saying to the government, stop looking back 2 years. I've had one of these life-changing events, marriage, death, divorce, work stoppage, work reduction, those kinds of things. 8 of them. And so you can say, stop looking back at 2022. I retired in 2023, or I've retired in 2024, and you can give them different numbers, and that's part of the appeal process. You give them new numbers based upon the life-changing event and that date, and then you can either reduce your IRMAs or eliminate the IRMAs fully. And yes, sir, it is Lon, it is the SS44 form that's filled out. It's an 8-page document. You only have to send the first 3 pages. That's it.
Okay. If I am on SUP in, can I switch to G?
Okay. You can, but other than in New York, Connecticut, Maine, Massachusetts, you're going to have to medically qualify to move from the N up to the G plan. Got to medically qualify. No carrier is going to let you move. Now, sometimes carriers will let you go G to G or G to N, but never N to G. And by the way, N is a fine plan. I know you run the risk of excess charges, but it happens less than 5% of the time. So don't, if you can't medically qualify, then, don't feel like you got a bad plan because you don't. I honestly, folks, if I'm 63, when I go on Medicare, if everything stays as right now, I still would do a G plan. Why? Because I'm wired. I don't want surprises. I don't have to worry about any copays. I don't have to worry about excess just in case it ever become a big issue or I went to a place where they charge it. For me, the extra $30 a month, I'd rather just go ahead and not be concerned about it. Others feel differently. And I keep talking about this couple. They both went with in-plans. And I certainly did not discourage them. That was their decision. They were fine with that. So if you have an in-plan, fine decision, good decision.
Okay, good question here. I will retire in a few months at 62. My wife will be 67. She does not have enough credits on her work record. Can she get Medicare on my work record if I do not sign up for Social Security until later?
Yes, because all you have to do, you had to be married. If you're married now, you had to be married for at least a year. You do have to be 62, and now she can draw her Medicare off your work credits. Now, what's a bummer about that, and I'm almost sure I'm right about this, I still think she's going to get a penalty, and that stinks. Even though she wasn't eligible, I think you're going to see a 20% penalty on that Medicare B because because she could have started at 65 even though you weren't yet there. I hope I'm wrong on that one, but I think the last time I checked on that penalty is still going to be assessed. So that's the way it works.
Okay, if my husband and I want a supplemental plan and we are on A and B, do we both have to pay a monthly premium for the supplemental plan, or is it one payment for both of us?
Hey, can I share one thing real quickly? Back to the other guy.
Yeah.
Now let's think this through. If she was covered by a group plan, though, then I don't think she'd be penalized on that B. That's exactly right. Yeah. So correction. What I would do on that, I would do that L564 form whenever you get ready to start her on Medicare, so you can prove to them that she did have credible group coverage. So I want to give you accurate information. Now, if she wasn't covered by a group plan, then she's still going to be subject to the 20% penalty on the B. Okay, but that's right. So take the time to do that L564 and bring her in that way, and that will work. Sorry about that. Okay, what's this one?
Okay. If my husband and I want a sup plan, we're on A and B, do we both have to pay a monthly premium for the sup plan, or is it one payment for both of us?
Yeah. Well, you definitely have separate policies. You're going to have separate premium amounts. Now, some of the carriers, especially United Healthcare, they will do just one bank draft, which will include both of those. But there are household discounts, so you can get a discount by being with the same company, but it's still 2 separate policies because if one of you passes away, the other one still has coverage. So that's the way it works. So it'd just be a bank draft matter.
Okay, let's hit this one. Mary Young, yeah, that one right there. How do you stop 8 calls every day from the telemarketers involving insurance companies? So one of the best things you can do is you can go into your phone settings, and maybe you guys can write this down.
Daniel, we figure out it eliminates us too. We talked about this.
Oh, does it? Oh, well, never mind then.
Remember we talked about
You can
this.
go in and you can block unknown numbers.
Yeah.
There's a way to do it inside of your iPhone settings. Just look up block numbers, but you don't want to block our number. So save our number, which is 800-864-8890 in your phone. And for all of your Medicare questions, comments, concerns, anything, you need to save our number, 800-864-8890, and we'll be able to serve you. But then you can go into your iPhone settings, and you can click block unknown callers, and then you'll just receive a notification that they called instead of actually having that phone ring.
That's good. I like that. All right, very good. And Mary, it's like that, especially when you turn 65, and then it happens every year at Medicare open enrollment season. So it is annoying.
Okay.
It is.
Well, let's see. I turned 63 this year. Is this the year they use for IRMA, and is it permanent or can it change? Yes, likely. So they're always going to, a little bit depends, but if you turn 63, what they're going to do is they're going to
But
look
IRMA's
back.
not permanent.
Well, I don't know. They're going to look back 2 years. So right now, everybody in January that's on Medicare that would have had above the threshold in the year 2022, right? They're going to say, hey, you've got an IRMA, and you need to pay this updated amount. Now, you can appeal that, right? But every year they will adjust that. So January of 2025, next year, they're going to be looking back to 2023. So if in 2023 your income had then dropped below the threshold, you're not going to have an IRMA. So it doesn't last forever. It's not like if you sign up now, it's going to last till the end of time. They're going to look at that every single year. They're always going to go back 2 years. And you can appeal that using the SSA 44 form to say, hey, I've had a life-changing event, the most common of which is I've retired, and now I don't make that level of income.
Yeah,
Okay.
you're right.
What do you advise about the UHC Medicare Advantage plan? We can't say anything really about plans on this. United Healthcare is a huge, massive company. A lot of good ratings. We got to leave it at that. You can, otherwise United Healthcare compliance will come after us. Even if we say nice things about them, they won't like us. So
I'll say this: they're just as good as any other company that's in the market for sure.
yeah.
Okay.
So,
Yeah.
but you can call us one-on-one. We can talk you through the different options, and United Healthcare will absolutely be one of those options, for sure.
Yeah.
Okay, let's see. My spouse worked 30 years and now the last 20, Social Security disability income. When he collects Social Security, then I collect, how should I take it? I've been working 50 years. Should I take his as spouse or mine at 65?
Okay.
Waiting to then take
You
mine.
don't have to worry about it.
Yeah.
Because some of the rules have changed the last few years, and the whole issue here is called the deeming principle. Deeming principle. So when you apply, you're going to give them your information. It's on the application, and they're also going to ask about your husband. And when the caseworker that's assigned to your case looks at all the information, you have to take the greatest amount that's available to you. So if 50% of his is greater than your own amount, that's what you're going to take. Okay, so it's deemed. You've deemed to apply for all benefits that you're eligible for, and that's what they're going to give you. So that's the way it works. Whether you apply online or you do it over the phone, it's the same process.
Okay.
And yours will not grow. Yeah, so those days are over. We used to be able to take spousal and your account grew, but that didn't happen. You had to be born before January 1st, 1954 to do that.
Okay, this is interesting. Larry Clark, if I plan to retire last day of April 2024 at 65 and 4 months, when should I start the Social Security and Medicare process? So if you're at 65 and 4 months, you are going to have to enroll into Medicare using the special enrollment period, right?
Which means he has to be working.
Yeah, which means you have to be working
65th birth month.
at your 65th birth month, which would be January, right?
So if I plan to retire last day of April, and that's 65 and 4 months. Okay, it's
Yeah,
fine.
so you're
SEP.
what you may
He's
do
fine.
is as long as you're working when you turn 65, which would be this month, then you're going to be fine. But you're going to enroll. You're going to have to enroll in A online first, and then you're going to use the SEP paperwork, which is CMS L564 and CMS 40B. Those two forms. The CMS L564 is going to go to your employer. The CMS 40B is you're going to fill out, and then both of those go to the Social Security office. One thing that you could consider is enrolling in, what would that be, March?
Yeah, just well, the last month of your IEP.
Yeah, which would be March, right? January, February. Well,
And I wish, hey, Larry, what's your date of birth? I appreciate your question. We can answer, but I want to. Give us your date of
can you
birth.
keep track of that? See
Yeah,
if he
let us
comments
know,
in.
and then I'm cool. I'd like to know that.
Larry, if you're still on here,
Yeah.
can you type in your date of birth, or at least the month and year?
Yeah, month and year.
We're going to go on to a different question, and we'll come back to this because we don't
Yeah,
tell you the whole thing.
yeah, we don't want to guess at this at all. Please.
Okay, Laura Stachel said, I am still working and have medical coverage, but I don't like my plan. Should I get AB plus Medigap, and which Medigap do you recommend?
Okay, very good. I would for sure, Laura. I would compare the two. And if you're not happy with the plan because of cost, coverage, network, whatever it is, it's fine to go on Medicare at 65. Lots of people do. So I would recommend that. Now, when it comes to Medigap, do me a favor. Not sure where you're from, but we write for lots of carriers. And in some markets, certain carriers are a little bit more competitive than others. In other words, they kind of go after certain markets. So if you would just call our 800 number here, let one of our agents tell you the prices. And we'll look at stability of rates. We'll talk about, pros and cons of all the companies. So I'm just reluctant to say, this is who I'd go with. Now, if you're right here in my home state, I can tell you exactly what I would do. But I don't know where you're from. And so I'd rather you just call in and let the agents look at all the different companies, give you prices, premiums, and we'll give you several, and then they'll talk about stability of the rates. And you need a drug plan as well, so they can take care of that at the same time.
Okay, as a veteran with VA benefits, what should I enroll in? I'll be 65 this year.
Okay. Well, Alex, if you're really happy with the VA and you know that you're going to continue to use them, and you have a nice benefit, like maybe they're covering 100%, then in my opinion, even though I love supplemental plans, to me, I think that's just too much insurance for you. Again, you're going to use the VA probably, you like that, you're happy, but then what I would do is I would enroll, in your situation, I would enroll what's called a Medicare, it's called an MA only plan, Medicare Advantage only, because you're going to get your prescription drugs through the VA because they have such low copays. And then you use your Medicare Advantage plan for a couple reasons. Then you can get some of the, the gym membership, the over-the-counter card, and some of those perks that they give you. But also, you could be in an area where, because you have an MA-only plan, you can get some type of a credit on your Part B. And I've seen some of those, Josh, $100 a month. And so that'll kind of help offset that expense. Now, if you weren't a veteran, I have a whole different opinion. But because you are, and if we like the VA, you're going to get good benefits. That's what I'm saying. I think an MA-only plan would be a very good option. And we write those all day long, and happy to find a good one in your area if you'd like. So call us, and I promise you our agents could walk you through that process.
How much can you make in order to keep the lowest tier of Medicare payments $174.90?
Okay, if you're single, you have to stay below $103,000. If you're a married couple, got to stay below $206,000. And remember, that's modified adjusted gross income, line 11 plus line 2A on the 1040. AGI plus tax-exempt interest. $103,000, single filer, married couple filing a joint return, below $206. Those numbers change every year a little bit.
Okay. Spouse is on Social Security disability. They're starting his Medicare A and B on February 1st. How do you know which supplements, et cetera, to fit your needs? Also, he has a 401k from a Honda of America that we transferred to Edward Jones. So if he starts drawing out of his retirement at 59.5, will his Social Security disability get penalized?
Interesting. I thought Social Security disability was really just based upon would be income you're working. They allow you so much money that you can make. And then beyond that, it's an issue. But if it's some type of retirement fund, I don't think that's going to hurt you with your Social Security disability. Now, the second issue with you, Carolyn, I'm not sure where you're from, but federal guidelines do not make every insurance company write supplemental plans for people that are on disability, meaning they're not yet 65. In fact, most states do not even make that as an option. So if you're in a state that supplemental plans are not written, then your husband's going to have to go on a Medicare Advantage plan. But the good news is once he hits 65, he's coming into what we call as IEP2, and now he's going to have a second opportunity to basically reset the clock, and then he can get a supplemental plan. Now, if you're in a state that says that he can get a supplemental plan, it could be at a higher rate because some states do that, and then he can start again once he hits 65. So you don't want to miss that opportunity. Yeah. So, Carol, it really depends on where you live. And again, all of our guides know that. You just call in, our agents can walk you through that process. They'll tell you if SUPs are available or not. Federal guideline does not make states do it, but some states require it, and that's why I'm saying it's kind of based upon your state.
Okay, let's see. Could you clarify that the Social Security earnings penalty is just withheld while you're working and hit those earning limits, but those amounts withheld by Social Security are repaid by Social Security after your Social Security full retirement age?
Okay, yes, I can. So what this person is saying is that when they withhold that money, so let's go back. Let's say we're above 4,000 above, and for every 2 we lose $1, so they withheld 2,000. Okay, so what happens is that $2,000 you're going to get back, but here's the key: it is not going to be lump sum once you hit full retirement age. What they do is they recalculate your benefits. So your benefit's going to go up some, but I promise it's not going to be lump sum. I know the formula, I could teach it, but it gets a little complicated without having a whiteboard to show you. But again, I just always say it this way: you get it back, but it's more prorated. They recalculate your benefit amount based upon the amount of money that they set aside. So if they withheld 6 months worth of checks, they recalculate it, including those 6 months. So your Social Security check goes up a little bit because of that, but it's not the full amount.
Okay. Here we go. This is a good one. My wife starts Medicare in July. She will do Plan G like me. Very high drug costs. Can we review the best Part D plan soon? I would like to get an idea. 2 drugs cost about $10,000 per month. Absolutely. Give us a call. 800-864-8890. The phone number is scrolling at the bottom of the screen. If you call, you've got about 43 minutes that you can call our office, scheduled appointment. We'll look at both the Plan G with you and obviously the drug plan, because that is the biggest component for you guys.
That's right. Yeah, because the drug plans aren't going to change.
Yep.
They're out for the whole year. So July's no problem.
Hello, do you have to submit that form to adjust your IRMA expense every year if your income changes? Yes.
Yes. If you have an IRMA and you're going to appeal it, the life-changing event, you can use that event for 2 appeals. Okay? So you would have to do that. That's right.
Okay. Let's do this. Social Security question. My birth date is 11/1957. What is the full retirement age for me?
Okay. So that's going to be 6 months. So we had 6 months to that. So 11/1957. So 66 is going to put 2023 and 6 months. So we have December, January, February, March, April, May of 2024. You hit your full retirement age.
So soon.
Very soon.
Okay. If my wife's birthday is 4/1/24, turning 65, and is on ACA, can she stay on ACA until July 2024?
Okay. Well, here's the thing. Yes, but what happens effective March 1, 2024, there would be no cost sharing for her. There's no tax subsidy. And what happens, a lot of people don't find this out till a year later. So if she's receiving a subsidy, which she may be, then you're not going to get that. It may appear as though you're getting it, but they're going to go back and do an audit. I guarantee you're going to be charged. So you need to put her on Medicare A and B 3/1/2024. You'll regret it if not.
Okay, when enrolling in Part B, how long does the response take? I already have a Medicare Care for Part A.
Yeah.
Medicare card for Part A. Yeah, so generally speaking, once you've enrolled, it's going to take somewhere around that, like 2 to 5 weeks, 2 to 4. Always used to be 2 weeks you would get a card, or you would get a letter, and then 4 weeks later you'd get your card. And we just saw through COVID that really slow down, and they're getting better and better and better, but really hasn't totally returned to that 2 to 4 weeks.
Yeah. And let's talk about they can go online and check it.
You can go online. So you can go to your socialsecurity.gov account, and you log in, do the login, the verification, and then there's a line, there's a spot to click that says get a benefits verification letter. Get a benefits verification letter. And you click on that, generally about 2 or 3 weeks after you've applied for Part B, or, well, if you already have and then it'll tell you, 2 or 3 weeks, and then it'll tell you, hey, the Part B's there, or it's not there yet.
Yeah. You can just follow the status.
Yeah.
And your number's not going to change.
Yeah, I was
the only thing
thinking
you're
about
just going to, sorry about that.
Just
That was
log
my
into
bad.
Medicare or socialsecurity.gov, and it'll tell you your status.
It will. But here's the thing. Listen, if you applied for Medicare Part B and you asked for an effective date of 2/1/2024, and you did that this month, it's going to happen. Even if you don't have the card yet, they haven't even processed it, they will backdate that to 2/1. I promise you. It's called a protected filing date. So the date you do it, they treat it as though it's already been approved.
Okay. Let's see. I am 65. My last day worked was June 30th, 2023. I have full coverage till June 24. When do I need to enroll? When is my SCP?
Okay, I'm 65, last day of work, yeah.
So I'm guessing you have Cobra?
Yeah, it doesn't matter.
Yeah,
Okay, and I'm sorry, you're not in a good position. My last day of work was June.
When did you turn 65?
Yeah. We need to know when your birthday is.
Ermina?
Yeah, can you,
Armenia?
if you're still on, let us know your birthday, and I can tell you exactly what's going on in your situation. Because you probably don't have an SCP. Let me know your birthday, and I'll tell you exactly what to do.
Okay, if I'm already receiving Medicare, but not Social Security yet, is there a separate Social Security registration process I need to do in advance?
Yeah, absolutely. Yeah, it's a separate application. Just go to ssa.gov, and as long as you're on Medicare, so that means you're 65. So you just apply for Social Security benefits. If you don't do it online, you can call local office, set up a phone appointment to apply for Social Security.
Okay. Hi, I'm Barbara. I turned 65 in August. Do I sign? Yeah, so 90 days before. So August, so that'd be July, June, May. Anytime after May 1st, give us a call. Phone number's along the bottom of the screen. We'll walk you, hold your hand through the whole process. We do it about 2,000, 3,000 times a month for clients. So we know how to do it.
Yeah.
Let's see. If I'm enrolled in Medicare but decide to return to work for a large employer, can I unenroll in A and B, participate in a high deductible healthcare plan, and make contributions to an HSA? No.
No. You can disenroll from Part B, but remember, you can't. If A is free, then you cannot disenroll from Medicare A if it's already gone effective. But you can drop the B, but you're not going to be able to put into an HSA now. Not going to be able to. Yeah. And I think it's smart to disenroll from B if you have a good group plan. Pick it up, come in an SCP later.
Okay, was this one of the ones we're coming back to? My wife's birthday is 4/1/24, turning 65, is on ACA. Can she stay on ACA till July 24? Also, she's on Manjaro, and we were paying about $50 for a 3-month supply.
Yeah.
That's why they want to stay.
Okay, yeah, I understand it. So her birthday is what? Birthday is 4/1/2024.
So she's eligible.
Okay, she has to go on. She has to go on A and B. Your ACA plan, all the tax subsidies, the reduced premium, all that's gone. 3/1.
You're paying full price for that.
Yeah, so
ACA
you're not going to see benefit from that.
Okay, Chris Townsend said, will this be available later? Facebook refused to show it, and I only just got here, having now missed nearly half an hour. Yes, it will be recorded. It will be put into both the YouTube channel and will stay in the Facebook Live group, or the Facebook group, so you can watch the full thing. If I do not want to take early Social Security, can I take it anytime I desire thereafter? Correct. Sure.
That's right.
Yeah.
Yeah.
Helga says, I signed up for Social Security and A and B Medicare. How can I add supplements like D and G? Well, call our office and we'll be happy to walk you through all the different drug plan options, all the different supplement plan options. If you're interested in Advantage Plan, we can compare that as well.
Yeah, and let's clarify something here. I don't know when you did it, but it's real important that you get a supplemental plan within 6 months of your B date. Now, you can apply in advance of the B date. The supplemental plan won't go effective until B date, but if you don't have a supplemental plan already in place and your B date begins, what you have is a 6-month window called the Medigap open enrollment period. And during that 6-month window in every state, there's no medical underwriting required. That insurance company you choose, the letter you choose, the plan you choose, they have to issue the policy. So when you say, how can I add it? Well, you know there's a time limit here. Now listen, on the D plan, you only have 3 months to do that once your Medicare A and B have started. So 3 months of that. So be sure that make sure you make these decisions during that window of time. Sounds like you just signed up for it, so you're doing fine. Just don't wait too long.
Okay, let's see. Al Nickel, my birthday is 11/56. I've already signed up with Medicare School. Great. I don't know what this is saying.
Was he the one we asked for the birthday?
I don't think so.
Okay.
Brenda Cobb, more than 20 employees. I'm 67. I have Part A, so should I enroll 30 days into Part B? Okay, guys, you're going to have to really write clearer. Okay, please write with complete sentences, because some of these questions I'm not getting at all. Okay, is the $33.50 max RX cost prorated if you start Part D halfway through the year?
Is it prorated? No,
No.
no, it's not. They're just saying that's the max you'd be out of pocket. So yeah, it's not prorated. Nope.
Okay.
Now again, you're only going to be on a plan less, so you may not have.
Yeah.
You may not get there, but that's the limit for the whole year, whether it's 2 months or
It's
12.
always calendar year.
Yeah.
So whether or not it's 2 months or 12 months, that's the max. Okay, if you get Medicare A and B and sign up for a Plan G, can you switch to Plan in next year or vice versa into G?
Okay, and the answer is, generally speaking, no. However, there are certain states that are called birthday rule states. And so what happens and you just have to look at the birthday rule states. There's basically 14 of them, really 13 and one, Missouri's anniversary rule, but it's basically the same concept. And the anniversary rule states that, birthday rule states that around your birthday, some states are 30 days before birthday, 30 days after. Some it's your birthday for the next 90 days. Some your birthday for the next 60 days. It varies. Every state's different. But if you're on a Plan G in most states, you can move to a G or you can move down to an N. No underwriting required. But if you're on an N, you cannot move up to a G without underwriting. So if you're in a birthday rule state, again, there's 14 of them in the country. Right now they have special rules. So you can make a move. Equal G to G or G to N, no underwriting required. But if you don't live in one of those states, then you're going to have to go through medical underwriting to move any kind of a plan.
Okay. Can you change plans between Medicare to Advantage and back? You kind of just covered a little bit of that.
Okay, between Medicare Advantage and back. Well, listen, folks, as long as you're healthy, you can almost always change your plan. And so if you're on a Medicare Advantage and you move to a supplemental plan, what happens is if you've been on that Medicare Advantage plan for a year or two or longer, sometimes even less, but let's call it a year or longer, and you want to move to a Medicare supplemental plan, you're going to have to medically qualify to do that. We have to ask you 30 health questions, look at your meds, get a statement from your doctor. So there's a process. So it can be very hard to move from Advantage to a supplemental plan if you cannot medically qualify. And I mean, rheumatoid arthritis, you're not going to get approved. One incident of AFib, you're not going to get to move. Spinal stenosis, insulin-dependent diabetics, they're hard to move today. So that's why we tell people, when you get on that Advantage plan, you stay on that for a while, and you want to get off. Don't wait till you're unhealthy, because you're not going to get off. You'll be on that Advantage plan for the rest of your life.
Okay, 77 Gator Pop. I believe I understood you to say there are no medical questionnaires on supplements. Are there on Advantage plans?
Okay. Well, I didn't say that. I said that during the first 6 months of your Medicare B date, there are no questions asked. That's called guaranteed issue. Insurance company have to write the policy. It's tied to your B date. You can apply 3 to 6 months before, but the official window begins there on that B date, 6 months. After that, there will be questions. Okay, now, Advantage plans never have health questions. You can get those anytime you want. There's times to get them, but when you get an Advantage plan, no health questions asked at all. As long as you have A and B, and you pick a plan that's in your service area, you can get it.
Chris Townsend says, how do you find supplemental plans?
Call us. Yeah, really, truly. I'm not trying to be smart with you here, but yeah, just call us. We write for lots and lots of carriers, and we can tell you about the company, stability of rates, premium increases, all that stuff. That's our business.
Good question. I turned 65 in June. My current plan at my job is $400 a month for medical. Should I eliminate that and just go on Medicare with a supplement plan?
As a general rule, yes. Anthony, the only reason I would say you wouldn't is if you make about $500,000 a year or more, because then you're going to have a pretty high IRMA, and it may not make sense. But other than that, if you're below $500,000 in income, even if you have a small IRMA, $400 a month, you can get on a Medicare B, Medicare A and B and supplemental plan right now, and a good drug plan for in the $300 range a month. And your deductible is only $240 on the G plan. Right now at work, $400 a month, you probably have a $1,000, $1,500 deductible. So Medicare will make sense for you.
Okay. Let's see.
And I was assuming that 400 is just for you.
Spoke to Aaron a few days ago. He mentioned that applying for Medicare and Social Security during the same time period can be problematic. Can you speak to this?
Well, the only and it can be if you're kind of down to the wire. But if we're applying for Medicare 3 months in advance, then I'm all right tying a Social Security application to that. But if it's 30 days out, I wouldn't want to do that because most Social Security applications right now are taking about 8 weeks. And so if we have to start Medicare in the next 4 to 6 weeks, that's going to be a problem because they're going to be slow on processing your Social Security, and they always process that first before they complete the Medicare part. Now your dates will still be fine, but it's going to be delayed because Social Security takes longer. I'm telling you, it can be 2 months. So that's the problem that Aaron was probably talking about. But again, I'm all right. 3 months, 4 months in advance, you're fine with a Medicare Social Security application. Even on Social Security because they'll ask the A and B. They'll ask the B.
Okay. I'm over 66 years and I'm still working. When do I need to sign up for my Medicare?
Well, you don't have to do anything. As long as the group is 20 or more, you have a good group plan, you don't have to do a thing. So when you get ready to retire, 3 months before, reach out to us or whoever you're going to use and then get that whole process going. Keep in mind, you're coming in a different period called special enrollment period, so that paperwork does need to be done correctly, and 99% of all ages don't even know how to do that. And so we'd be happy to make sure it's done properly.
Laura Stachel, through my employer, I have Blue Shield and hate the coverage. I turn 65 next month. Should I drop the group plan and do A, B, and Medigap?
Laura, I would. Yeah, for sure. If you don't like it and the price isn't good and all that. Now, I'm assuming, Laura, you don't have children or spouses covered by the plan because you always got to kind of bring in that into the equation. But as long as no one's going to be hurt, go on Medicare. Your employer has to let you go at 65. Now, those of you beyond that, keep this in mind. They don't have to let you go at 67 except during the company's open enrollment season. Now, we find that most employers, they're happy to let you go anytime. But they can technically say, no, you can go at 65, and then at a later date could just be during the company open enrollment.
Okay, spouse has had coverage forever, but just retired 12/23. I'm disabled 25 years, but not on disability. I don't know the first thing I'm supposed to be doing here, but I'm 65 in 3 months, which he did.
Okay, well, then what I'd be doing is, since you're not on disability, I'd be applying for Medicare A and B. Now, as far as a disability application, I don't know if you're asking about that. Social Security.
Oh, what do you need to do? Probably just call us.
Oh, okay.
We'll walk you
Okay,
through
sorry.
everything, right?
Yeah.
If you're turning 65 in 3 months.
Yeah, it's time to get enrolled in Medicare A and B.
Yeah.
I thought maybe they're not about should
Yeah.
you apply for disability?
No, I don't think so.
Okay, good. So, hey, you're in the perfect time. Give us a call. We'll take care of that A and B enrollment and get you set up on whatever other insurance that you need.
If I have a MedSup in and live in South Dakota and I move to another state, do I have to re-enroll or be subject to underwriting?
No. All supplemental plans are portable. Lifetime policies cannot be canceled by the insurance company because of relocation. You'll take that policy with you. Now, the carrier has the right to re-rate you up if you're moving to an area where prices are a little bit higher. Your premium may go up because of that, but usually it's fairly minimal. But that's the only thing they can do. They cannot cancel it. It's a lifetime policy.
Okay, my husband's still working until December of 24. I'm under his large group plan, the husband's plan. I do have Part A, but when he retires, when should we sign up for Part B if he's retired in December?
Okay, here's the way that works. And again, I'm just talking about you. What you have to do is, I'm assuming that he'll be covered through the end of December. So sounds like for me, you need your coverage to start January 1, 2025. So what I would do is about 3 months in advance of January 1, 2025, so you hit around October, that's when you need to get everything set up to verify that you've had coverage. That's the L564. It goes to his employer. Enroll in Part B. You pick the date, January 1, 2025. It'll be a very, very smooth transition. So that's what you do. Okay. Yeah, and then the good thing about that, just so you know, Brenda, is that all the 2025 drug plans will be out after October the 1st. So it's perfect timing. You can pick out a Part D plan for 2025, pick your supplemental plan out. So right at that October 1 date is perfect. And we'll do that for you. Happy to do that. Walk through the whole process, the L564, 40B. Our guys, our agents actually fill all that out for you, get it to you. Then you, of course, got to get it completed. But we'll make sure the process is started properly.
Okay, I'm on Plan G with Aetna. If I find a less expensive plan when my plan is up for renewal, can I switch to a different company that is less without any medical info?
Most states' answer is no. So the exception would be California, Oregon, Washington, Idaho, Nevada, Oklahoma, Maryland, Missouri. So I think I may miss one or two in there, but you see the point. Most states, you're going to have to medically qualify to get off that plan. But if you live in a birthday rule state or anniversary state of Missouri, then you can make that right around your birthday. Anniversary is around the anniversary of your policy. Okay, 30 days before, 30 days after. So depending on where you live, will determine the answer to that question. Yeah. Illinois, it's only between the ages of 65 and 75.
Okay, Charles Marquez says, I'm turning 65 in July but retired. Do I need to wait till Social Security contacts me for Medicare even though my wife is younger than me and I'm on her insured through work?
Retired.
Insurance through work.
I knew it.
So you're going to get your card if you're...
He's
wait,
saying
no, he's waiting. Contacts me.
Okay. I think he's saying he's on Social Security.
Yeah,
That's because you're saying retired. Okay, very good. So let's just back it up. Do I need to wait? Yeah, you don't have to contact them. Charles, if you're on Social Security and your birthday is July, so let's back it up. June, May, April. So you're going to get your card at the end of March, right? That'd be back, right? Yeah. So you should get your card around between March 15th and March 25th. Is that right? July, June, May, April. Yeah, March 15th, 25th. They're going to mail you the card. And you will be automatically enrolled in A and B. And once that card shows up, now you're ready to decide your other insurance, supplemental plan, drug plan, advantage plan, whatever you want to do. Call us. We'd be happy to help you with that. Okay. Now, can you go back for 1 sec? Okay.
I have no idea where that one
Okay,
was.
sorry about that. I want to mention something. If your wife is employed with someone that has 20 or more employees, and it's good coverage and the cost is good, but better than Medicare, then what you can do is you actually can send the card back in and have A only if she's going to keep working for a while.
Okay, this is a good one. Please do a video on the 30 questions to switch. Basically, what are the questions? That's a good video idea. Great video idea, Vince.
Okay.
So if you're going to switch
yeah.
supplements, yeah.
Okay.
What would be an overview?
Okay, an overview would be this. In the last 24 to 36 months, have you had any issues with heart, which would be stent implants, heart attack, anything like that, heart disease, heart, lung, which would be COPD, emphysema, those kinds of things, heart, lung, liver disease, cirrhosis of the liver, those kind of things, heart, lung, liver, and kidneys, kidney failure. So those are the big organs they're going to look at. And then we're going to ask about cancer in the last 36 months. If you're a diabetic, it could be all right, but have you had complications, retinopathy, neuropathy, those kind of issues? You're going to be declined if you had complications. So that would be it. Heart, lung, liver, kidney, cancer, diabetes. If you've had a stroke in the last 24 months, had any kind of like you've been recommended to have a knee replacement or hip replacement, they'll deny you for that. So that's good.
We'll do a video on it.
Yeah, that was kind of a
If you have any
summary.
other video ideas, put them in the chat right here.
Yeah.
That's great. Okay, we are going to do 2 more questions. Does your employer send your CMS L564 back to me, or do they send it directly to the Social Security Administration?
Yeah, they're not going to send it to the Social Security Administration because it can't be processed without the 40B, so that's not going to happen. In fact, we don't even find that employers even generate it. You normally have to generate that. There are exceptions, but usually you generate it, get it to your HR department, and you can scan and email it. They complete it, and they can scan and email it right back to you. Then that with the 40B is going to be given to the Social Security office. Mailed in, faxed in, dropped off. By the way, we do this. If you fax it in, we also always mail a hard copy. Okay, if you drop it off, there's usually a guard at the door. They'll take it. All right?
Okay, I am, we got one more, and I'm not going to, this is the last one. I'm turning 65 November. I work for a big company with good benefits. Do I need to go on Medicare?
Nope. No. Yeah. 20 or more, you don't have to do A or B.
Okay, guys, we do these live streams once a month generally, and so we'll be doing one in February. We usually go on for about 60 to 90 minutes. Looks like tonight was 90 minutes, so we really appreciate all of your attention, all of your time. If you need assistance with Medicare, we have a team of people. We would love to help you. The phone number is scrolling along the bottom of the screen there, 800-864-8890. You can call in. We've got people here answering the phones for another 30 minutes, and they can schedule your appointment. I think we're all full for like the next several days, but probably towards the end of next week, we might have some availability. Again, we help probably 2,000 to 3,000 people every single month walk through Medicare from A to Z, make sure they have the right coverage that works for their specific situation. And again, it's a free service. You don't have to pay us anything to do this. We don't work for free. We are paid by the insurance companies as an independent broker.
Yeah.
So we don't have a company bias or whatever.
Yeah, and really, I like what you said. And folks, the price is the same. If you went directly with United Healthcare and they quoted you $130 a month, that's the same price we're going to quote you. But now you get the benefit of having someone who's going to really help you. You're just not just a number. So
yeah, we have a 100% U.S.-based customer service team that come in every single day. So one of everyone's big questions, like once I enroll in a plan, are you going to forget about me? And the answer to that is no. Okay, we're going to help you through every enrollment period. We're going to answer your phones throughout the year. We're going to answer your questions. We're going to send you resources, walk you through everything for Medicare for the rest of your life. So it's what we've committed our lives to do.
Yeah, we don't transfer you to the Philippines or to China or to India. Nothing against those folks, but you don't want to be have your customer service on an international call center, and so that's why it's right here in our home office.
Lola Lucky, give us a call, and we're sorry that you're in a mess, you're confused, and you're so stressed, but you will get lucky if you call us,
Yeah.
and we'll help you.
We'll help you.
Take care, guys.
Take care. Thank you.
Thanks.